Welcome to today's 10-minute podcast powered by ALTUS Chiropractic and Physiotherapy. We have Nikkie Brar, a physiotherapist and clinician at the clinic. Nikkie, good afternoon. Welcome to the podcast.
Thank you. Very happy to be here.
I know there are many branches of physiotherapy. How varied is it?
So it's quite varied. The three main branches that we study in school are musculoskeletal, which is basically what in like a private practice clinic. So that'll be a lot of injuries to your muscles, ligaments, strains, sprains, those kind of things. Then you have neurological, so that you see a lot of stroke patients, spinal cord injury patients, concussions, etc. And then you have cardiorespiratory, which most people don't know that much about, but you actually do help work with people with like chronic obstructive pulmonary disease and different things like that. It's not as well known, but physios do work in that field as well.
And because of that, a physiotherapist will have a lifetime of learning different disciplines
hmm
and training and specialties, right?
That's definitely one thing I love about the profession is you can be in one area and then you can switch over and do something completely different. And there's always so many courses that you can take to keep bettering yourself, but you'll never get bored. That's for sure.
That's awesome. Now, what are you adding to your body of skill in the next couple of years, near future?
So I'm hoping to do a few courses. I really want to do acupuncture and dry needling. And I've been debating looking into doing a bit more neuro, so possibly concussion, because I do see quite a few patients that have had concussions from motor vehicle. And then pelvic floor physio is another interest. So that's another specialty you have to do more school for. So there's a lot of things that you can keep learning and specialize in that require additional schooling.
Correct. I hear pelvic floor is on the uprise. A
Yeah.
lot of requests for pelvic floor specialists.
Yeah,
Yeah.
definitely, yeah, and there's only a few therapists that do it, so it's
Right.
definitely a good one.
What kind of cases do you work with often in your practice?
In the clinic, I do see a lot of motor vehicle accidents, so that's usually a lot of whiplash, usually to the neck and the back as well, and I do see sports injuries, so a lot of, like, ankle sprains, Achilles tendinopathies, rotator cuff injuries, and then sometimes in my older population, I'll work with a lot of arthritis patients.
Okay.
I've also seen a lot of people with back pain from a disc herniation. So I've done a lot of work with patients who have like neuropathies or nerve pain as well. So it can be
I,
like a
I,
handful for sure.
Nikki, I can imagine with many different physiotherapists having different specialties and trainings, there must be a different approach. Everybody has maybe a different approach towards
Mhm.
treatment. What is your favorite?
I really like working with my hands. I'm more of a hands-on physiotherapist versus using modalities. So I like doing a lot of soft tissue work, mobilizations, and exercise prescriptions. So I give all my patients lots of exercises to do.
Can you tell when a patient comes in and has not applied the
Yeah,
exercises that you've
yeah, for sure.
is that more common than I think it is?
It's not too bad in the private section in the clinic because
Yeah.
people usually here, they really wanna get better, taking
Mhm.
the time, the effort to come in. Sometimes I've been orienting to outpatient, at the hospital right now because I also work at the hospital,
Okay.
and sometimes they just say, "Oh, no, I haven't done any of the exercises you've given me."
Have you seen cases where somebody has not applied the exercises, but they actually improved and got better?
Off the top of my head, I honestly can't
Okay.
think of anyone.
So no outs, folks. No outs. You got to do your exercises
Yeah, you gotta
in
do your
order to
exercises,
improve.
and we know. We can tell.
As we wrap up this episode, Nikki, give me a case that you remember where it was the before, during, after experience or journey with a client where you were really impressed with their progress and improvement in any branch or treatment type that you can think of.
Um, I had a patient who came in, for this hip pain, so I gave her some exercises to do, and then she called in, and she didn't come in again, and I was like, "Oh, no, did I do something?" But she called in, and she was like, "I'm all better. I don't need to come in anymore." It was really nice, surprising twist that she was actually just completely fine, and she was very happy, and she didn't need to
That's
come in
brilliant.
anymore. And so she
That's
did her
brilliant.
exercises, and she got better after the first session, and that was very impressive.
That's impressive. That's impressive. Hey, she
Mhm.
came in once?
She only came in one time for the initial. I
Okay.
had her booked again. She called and canceled, so I was just concerned. I was hoping that everything was okay,
Yeah,
but she
yeah.
just was completely fine and she didn't need to come in again. I knew she did her exercises.
That's amazing. Nikki's
Yeah.
prescriptions work. Okay. Nikki, thank you so much. Any final words for our viewers as we wrap up this?
Yeah, do your exercises, please, because we'll know if you haven't done them. And yeah, we're definitely free to answer any questions you have for sure. And if people do have difficulty doing your exercises, we can always change them about, make them a bit less, or find something that they do enjoy doing.
That's wonderful. Thank you, Nikki, for your time. Thanks for sharing about your physiotherapy insights for our viewers and listeners. Thanks for
Mhm.
joining us. Stay tuned next week as we have another episode from ALTUS Chiropractic and Physiotherapy.